Very warm welcome to everyone, and thank you for joining us and taking time tonight to put your health and well-being first. My name is Beverley Pinder, a member of the NIIM Advisory Board. My corporate experience stems to reputation management and strategic counsel and marketing. I am also a former councillor with the City of Melbourne, and for many, many years have put a lot of time, energy and effort into the not-for-profit sector. So this is Women's Health Week 2021. And tonight we have 3 NIIM clinicians who will share their professional knowledge, wisdom and experience to be healthy in mind and body. Individually and collectively across the globe, we're all facing many challenges. As women, we tend to adopt the carer role with extra responsibilities, which can affect our health and well-being. We all need to prioritize our physical, emotional, and social health by staying connected and seeking support from people who care about our health and well-being. As well as family and friends, it is important to have the right health professionals on your team. They will support you to maintain your health and well-being and help you manage through these very challenging times in particular. NIIM has more than 20 healthcare professionals, including doctors and allied health, offering a wide range of products and services and treatments, as well as, of course, a well-stocked dispensary, all to support you. If you're a member of Friends of NIIM, you will be receiving our regular online updates. But for those who are not, I really encourage you to join our NIIM community. And you can do that by logging on to www.niim.com.au. You will be privy to the latest educational developments, latest health research, and any events that we actually do stage. Without further ado tonight, let me call on our first speaker, Dr. Carolyn Bosak, Integrative GP at NIIM. Carolyn has a particular interest in women's health, caring for females at all stages of their life, as well as pediatrics, and an authorized prescribed medicinal cannabis, prescriber of medicinal cannabis. An Ironman triathlete herself, Carolyn holistically manages female athletes at all levels, helping them to optimize performance. Her topic tonight is Move and Thrive in Body and Mind. Welcome, Carolyn.
Hi, good evening. I'll get my talk up. Okay, good evening, everyone. So I'm here to talk about fitting exercise in the current climate. So one of the most important determinants of health and well-being, as we know, is exercise. I'm not here to convince you of the why of that, but the how, because that's become quite a challenge, as we all know. So with the COVID pandemic and the lockdowns, it's changed the flow of most of our lives, some of us more than others, and it's provided a lot of challenges in being able to maintain our health and well-being. So exercise being a very important determinant of health and well-being, and definitely a challenge to maintain it. I'm here to give some advice on how to fit it in, because even outside of this climate, it's people have always got reasons why they can't fit it in, and I can always, I think, come up with a solution. And as I said, if there's one thing I'll coerce and mandate for, it's exercise. So we definitely know this was the longest running study on women's health in Australia has been going for over 25 years, the Australian longitudinal study on women's health. And they've introduced a COVID arm where they're looking at different aspects of women's health in amongst COVID. And this report on exercise was actually a year ago. So at that stage, already 1 in 3 women were reporting reduced exercise, and I'm sure that it's a lot more now. So I'd be interested to see the next time that they send out questionnaires for that one. So what are the current challenges to exercise? So it's become a lot harder for people to fit in exercise due to changes in their routines, homeschooling, kids unable to go to childcare, reduced access to babysitters, working from home, closure of gyms and exercise programs and playgrounds, and also the geographical and time restrictions. Not to mention reducing mental health and mood and reduced motivation. That also impacts on our inclination to fit it in. And also people sitting down all day with their working from home, that can also affect their ability to exercise because they're actually quite sore. It's amazing, just for all else remaining equal, people who are just not getting that incidental walking around all day at work and to and from work, how that's impacted on their bodies. So personally for me, so anyone who knows me, I sing the praises of exercise. I'm an athlete myself, and this definitely this time has provided a challenge. I've lost my focus and drive. So I've changed the goalposts, and it's just a matter of trying to fit in something every day. And it's definitely not the blood, sweat and tears that I've been accustomed to. So what are my recommendations? So in trying to get the exercise in, it's do something most days, but not necessarily every day. Try and get outside every day. So vitamin D is definitely an issue for a lot of people, and that also impacts on well-being. And if you can, try and incorporate intense and easy sessions because they stress different energy systems. Variety is key. So if you can, try and incorporate different activities, strength, and then cardio, short sessions, long sessions. That just sort of builds an overall repertoire and variety into your programs, keeps you motivated, but also helps with your overall fitness. And adapt when you need. So, it's, make a shorter session, exercise indoors when you have to. So just as long as you get something done. Because I'll maintain there's a solution for every age, stage, and personal situation. So apart from you and your body weight, the rest is really optional. So look, I'm sorry for the busy slide. I've included, this is from my own home, and I've accumulated a lot of this stuff literally from Aldi and Kmart over the years. So different things are, exercise mat, skipping rope, hand weight, leg weights, arm weights, ankle and wrist weights, a roller and spike ball to get your massage done. So boxing mitts, that there's a weight bench there, so you can do some weights. But if you haven't got one of them, I've just shown there's some chairs there, and you can set something up just with chairs, so you can lie down and do some chest presses. Fit ball. And that's a bike set up on a trainer. So you just attach that. You can get those quite cheaply. And then it's a bonus if you've got a treadmill, an exercise bike and a home gym. These can even be hired. A phone or a tablet so you can access different programs, which I'll talk about later, or exercise DVDs and TV. And then if you get fancy, there are smart trainers, which I'll show later. But lastly, probably the most difficult to procure of all, sometimes the time and motivation. So putting it into practice. So these are some of the examples that come back to me as to why people aren't exercising when I'm doing an overall assessment. So low motivation, no group exercise or sporting groups available anymore, time poor or time precious, homeschooling, baby and young children at home, working from home, people who swim saying they don't have access to pools, or the gyms aren't open, or they're too sore and they're feeling injured, or they're unsure, they've got medical problems. So talking about motivation and time. So for those who don't have any barriers apart from motivation and time, I think you need to reframe, we need to reframe exercise as being as essential as part of our routine as brushing our teeth, but sometimes it's not enough. So if you need a group and need to motivate yourself, and you don't have access to your clubs anymore, so organising you can get access to gym run group sessions, or you can organise one with your friends and do like a yoga session or an aerobic session on Zoom. My club organised on the left there. So my club organised a smart trainer session on bikes, on an indoor trainer, and so people get together and do that, and that keeps people motivated. So if time is an issue, you'd be pleased to know that a workout session of 20 minutes or less of high intensity exercise alternating with a period of rest actually is as effective, if not more effective, than a long constant slow session. So a study from 96 where they had two groups of young men. So for the first 6 weeks, they just did 60 minutes of moderate exercise bike work, and then measured their fitness. And then the next 6 weeks, they did 8 minutes. So that was 60 minutes versus 8 minutes of 10 seconds. 20-second bursts of high intensity cycling, and then 10 seconds of rest. And they did that for 8 minutes. And at the end of it, they actually got a far greater effect on fitness and improvement in fitness in both the aerobic and anaerobic capacity as they did for the 60 minutes. So this can be translated. So they're called Tabata. So one of the authors there is Tabata, and that he coined the Tabata workout. So Tabata workout which could be 20 minutes or less. As I said, that one was 8 minutes. And that's where you alternate a high intensity workout, a high intensity activity with a period of rest. And you can do that with anything, with weights, with running, with walking, jump. So the one I've got on the left there, so just some body weight exercises, jump rope, squat jacks, push-ups, and you can get quite an effective workout. And some apps on your phone, something's called a Tabata timer, and so that'll time it for you. So it'll give you can set the period of activity and the period of rest, and it'll beep for you. For the swimmers out there, you'll be pleased to know that, safe with my triathlon club, our swimming sessions got replaced by 90-minute swimming sessions got replaced by a 15-minute workout based on this Tabata theory. So for mums with kids at home, now, I don't mean to tell you how to suck eggs, but it's amazing how many times I get resistance. So for mums who homeschooling kids, partner works all day, so I suggest either get up early. So sometimes it is a little bit ungodly in terms of the time that you need to get up, but get up early before your partner leaves, or take the kids for a walk after school, work out when your partner gets home or when the kids are in bed. If you're looking after your young baby, or young children all day without a partner, go out in a running pram, have a baby in a baby carrier. They're actually baby carrier workouts, which you can look online or download an app for those, which is amazing. So there's lots of different things that you can do there. Or you can do a short workout while the kids are sleeping during the day. And you can do that in the same room when the kids are playing. So I remember Michelle Bridges, who was a TV personality trainer, saying all she needed to work out was her own body weight, and the floor beneath her the size of a postage stamp. And it's very, very true. So for those who find it hard to come up with their own workout, there are lots of different apps that you can download and follow, and they guide you through it. So depending on your interests, and some of them will incorporate a group workout, so you can get on with friends and do the same workout. So you can use, so if you don't have for people who don't have access to their gyms, there's using either your own body weight or dumbbells. You can use, there are certain gym workouts that you can follow at home. They're completely guided. For someone like myself, I like exercise DVDs, and that's why I included those DVDs at the top. So Gillian Michaels, I find her workout's fantastic, and she's got some 20-minute workouts that are extremely effective. And all you need is a mat and a couple of dumbbells. And in terms of, so I did mention before, if you're unsure or if you've got medical problems, so you can get the advice of an exercise physiologist, and they can do a workout for you. So I think the rule of thumb with me is try and stick to what you know, don't start anything new. And if you don't have a history of doing that exercise, then you should get advice. So try and stick to what you know to avoid injury. So I'll finish off by reframing some COVID terms for the positive. So restrictions. So as you can see, restrictions to exercise are only perceived. There's always a solution. Variants, try and incorporate variety to your exercise routine. Be a super spreader of inspiration. Enroll others to join you in your quest to keep fit and healthy. And engender herd immunity against many of the negative health impacts of the current situation threatens us with. And one of those things is exercise. And for those who've never really exercised beforehand, use this time to create your own new normal and work out how you can fit being fit into your life. And instead of antibody dependent enhancement, ADE now is activity dependent enhancement. So let's create a pandemic of positivity. Thank you.
Wow, Carolyn, what innovative stuff. It's great. It's really sensational. I think my new mantra is fitting something in every day.
Yep.
That's what I strive to do, and it really does help. So thank you so much. Some great ideas there. I'll certainly be using some of those. Now, it is Women's Health Week 2021, and our next speaker is Dr. Horata Mosweu, medical doctor at NIIM. Horata combines her role in emergency medicine with being a GP. Her special interests include women's health, chronic fatigue, autoimmune conditions, arthritis, musculoskeletal issues, and nutritional advice. Her topic tonight, hormonal imbalances. Lots to learn from this topic. Welcome, Horata.
Good evening, everyone. Thank you for joining us today, and happy Women's Health Week. My name is Gorata, and I'm part of the team here at NIIM. So today I'll be talking about female hormone imbalance. I think we're going to go back to medical school for a little bit after Caroline's positive talk. So basically with this talk, what I'm going to cover is female hormones, which is estrogen and progesterone, that are actually involved in the imbalance. We're going to look at the normal functions of those hormones and what actually happens when those hormones are out of balance. And I'm going to have an overview or a snippet of PCOS and menopause, because those are mostly what I've seen in the clinic with most women. And also management. How can we manage sort of our hormones? How can we sort of in our lifestyle, in our everyday, actually make sure that our hormones are actually balanced. And there are questions that I'll answer at the end of the session. So those are some of the questions that I'll actually answer at the end of the at the end of the session. So did you know? So our estrogen actually communicates with the brain. So the brain talks to estrogen. So neuropsychology sort of estrogen studies have actually shown that estrogen has modulating aspects of neurotransmitter function. It is actually involved in brain glucose metabolism and also synapses and brain aging. So about 2/3 of people diagnosed with Alzheimer's disease are women. So is there a difference between women brain and men brain? So there's no difference in terms of structures and functions. The key difference is hormones, and that's where estrogen actually comes in. So if there is lack of estrogen, studies have actually shown that the brain ages faster, but a well-balanced estrogen is equal to actually healthy functioning neurons and healthy functioning brain. So within the hypothalamus, the estrogen helps so the hypothalamus regulate temperature. Hence why with people with a menopause, where there's actually estrogen withdrawal, they experience hot flushes. So the temperature goes up and down. And also in the brain stem, so sleep is also regulated around there. Estrogen helps with that. And hippocampus helps with mood regulation. So what are hormones? So hormones are chemical messengers that are actually produced by the endocrine system to maintain various metabolic processes. So estrogen and progesterone, they are our female sex hormones. Those are our steroid hormones. So the brain talks to the ovaries for the production of these hormones. And normally there's a synchronized hormone rise and fall of both estrogen and progesterone at particular times. So we have been bombarded with this particular picture in medical school and up till this moment during my medical practice. So this picture here actually shows that so estrogen is more dominant in the follicular phase, while progesterone is normally low during that time. However, after ovulation, we see a change of that progesterone rises while estrogen actually falls down. So when this is all well synchronized, so when it's all synchronized, we can say that they are actually sort of balanced. However, we know that not all of the women, but however, at some point in our lives, we do actually experience a time where the hormones are out of balance. So hormonal imbalance means that we're having a little bit of too much or too little of estrogen or progesterone. So they work together synergistically. So some of the symptoms that when somebody has too little or too much of progesterone includes some mental health. They can be anxious, depression, they can be depressed, and they can have some sleep disturbances. So metabolic syndromes such as type 2 diabetes and cardiovascular disease has actually been linked to a lack of estrogen or too much estrogen. Some people can present with infertility issues or low libido. Osteoporosis, which normally for bone health, we need estrogen. When estrogen is deficient, then we have bone thinning. And some people do present with dermatological issues such as acne and hirsutism, too much hair. So progesterone. So progesterone actually plays an important role in in terms of proliferative to secretory phase post-ovulation. It is that hormone that actually prepares the womb for implantation. It's one thing that I really love about it, that I've learned about it, is that it's an anti-anxiolytic. It works in the GABA receptors, which are mood lifters. So it lifts up your mood. And during pregnancy, it just prevents the myometrial, the womb from contracting, therefore actually promoting pregnancy. So estrogen, so that's the one that actually is, so has a mood-related function. It is an antidepressant. So progesterone is an anti-anxiolytic, but this one is an antidepressant. It actually increases serotonin, inhibits so the enzyme that actually breaks down serotonin. So it's responsible for our menstrual cycle, for bone health, for good heart health, puberty and sexual development, mood-related function, which I've already mentioned. And so they're in PMS and PMDD. So estrogen is actually linked to these mood disruptions. So however, the levels of estrogen in the studies show that they're actually normal. So there is a disruption in terms of how that actually processed, hence why there is a mood disruption. However, in post-perimenopausal or menopausal women, estrogen levels drop may result in depression or anxiety. So causes of low estrogen, age, such as menopause, premature ovarian failures, endocrine issues such as thyroid disorders, underweight, chemotherapy, and athlete triad, excessive exercise. Which means that raised cortisols that actually suppress estrogen levels. So people that have low estrogen might actually feel or might have symptoms such as hot flashes, night sweats, sleep disturbances, foggy thinking, so vaginal dryness, thinning of the skin, bone loss, and heart palpitation, and also just low libido. So things that actually causes estrogen to be high is genetic conditions, having ovarian tumors that actually produce a lot of estrogen, liver cirrhosis, which actually that means that there is an interference in terms of how the estrogen is processed. Lifestyle factors such as poor diet and consumption of alcohol, which actually interferes with the estrogen metabolism. Stress is another thing that actually sort of can cause estrogen to go up high, and pharmacological factors as well. So elevated estrogen, even though estrogen is so good, however, in elevated form, it actually induces depression, which is indirectly by actually affecting the thyroid, causing hypothyroidism. And excess, because it actually promotes serotonin. Therefore, elevated estrogen is equals to elevated serotonin, therefore resulting in anxiety. So in terms of menopause, which is menopause as natural, but during menopause we do actually see a drop in both progesterone and estrogen, that they drastically drop. And in comparison to males, that testosterone has got a slow decline as we age. But in women, that's why we actually have these symptoms, hot flashes, weight gain, sexual dysfunction, and all the symptoms because of the changes in the hormones. How can we best manage menopause? I guess if you're a person that you're at this particular stage, I would recommend that you have a medical review and seek help from your GP, empower yourself, and also ask your question, what do I actually want the doctor to help me with? What do I want them to address? And also having a really well-balanced diet that is full of phytoestrogens. Food like tofu has a lot of phytoestrogens, and strawberries, and supplements like calcium and vitamin D to support bone health, vitamin E rich food as well, because vitamin E has actually, studies do show that it helps in terms of hot flushes management. and other supplements such as B vitamins, omega-3, magnesium. Magnesium helps with sleep. So that is a chart from Australian menopause that actually do show so the herbal or vitamin supplements that actually help alleviate some of the symptoms that are actually caused by menopause, and also the mind body therapies that we can also employ to help with all the symptoms. So those are there, and those can actually be found on the Australian Menopause Society page. So now moving on to progesterone. Progesterone levels, when they're low, this is normally seen, if you remember that chart that I've actually, it's normally seen when there's cycles where there's no ovulation. And this is normally seen in PCOS, where there's luteal insufficiency. And also when people are taking sort of synthetic progestins that can actually lower the progesterone levels. So symptoms for when somebody has got a low progesterone levels is that they can have infertility issues, sort of headaches or migraines, weight gain, low libido, irregular periods, mood changes such as anxiety. And I'm going to talk about PCOS because this is one particular condition where we see where women they have periods where they don't ovulate, and therefore it subsequently results in low progesterone. So PCOS, what is PCOS? It's actually an endocrine disorder that affects reproductive age women, which is characterized by high androgens and chronic ovulation. It affects 8 to 13% of reproductive age women. And normally to diagnose PCOS, we need 2 or more of the following. So polycystic ovaries in ultrasound, oligomenorrhea, and high androgen levels. Because of exposure to estrogen that is actually unopposed, we see that women, or studies have actually shown that women who have PCOS, their risk of endometrial CA is 3 times higher than those women who don't have PCOS. It's quite significant. So in terms of PCOS management, so to oppose the estrogen, normally people need cyclical progesterone for 10 days every 3 months. So that actually reduces the risk of endometrial cancer. A diet and exercise is actually pivotal to PCOS management. And spironolactone can also be employed to help to manage excessive hair. Vitamin D and probiotics, actually, there's a recent study that actually has come out that it actually improves BDI-2 scores. And women who are trying to have children, metformin as a first-line ovulation induction before we move on to drugs such as clomiphene. I can't stress mind-body therapies because that actually reduces stress levels and it just does wonders to the body. One other thing that I really did find interesting is that spearmint tea, apparently it does reduce excessive hair. So those are the similarities between PCOS and menopause. So irregular periods, heavy bleeding, changes in mood, difficulty sleeping, thinning of hair on the head, and weight gain issues. So I don't know if I should address this now, but these are the answers to the questions that have already been asked. So I guess I will wait till later. Thank you so much for tuning in.
Thank you, Horata. I just think we need a full webinar on your material alone. It's fantastic. I've learned so much. Our final speaker tonight is Dr. Anjana Arun, Integrative GP at NIIM. Anjana combines the latest evidence-based medical and complementary therapies with her clinical experience to help her patients. Anjana has a wealth of experience in chronic fatigue syndrome and body burnout. And with her topic tonight being breaking through lockdown. Can't wait for some inspiration. Welcome, Anjana.
So my talk is about breathing through lockdown. And I think it's a really relevant topic for what we've been going through for the past year and a half or longer. And my first quote is, "Love and compassion are necessities, not luxuries. And without them, humanity cannot survive." And I think it's really, really important to remember that and find self-compassion for ourselves and also compassion for the people around us, our family members, as well as people working with us. Everyone is doing it hard. In the current climate, COVID brings unprecedented times. We're dealing with individual stress, we're dealing with the stress of the family, we're dealing with the collective stress as well. Some people are going through financial stress, and there's often grief and loss of friends and family to COVID or other causes. And there's relentless uncertainty, and humans hate uncertainty. One of the biggest things that this brings about in the pressure cooker of lockdown is it brings up trauma. And I think that's a really, really important thing to honor and recognize. And this is because many of us lose our management strategies, and often those management strategies could be exercise or social outlets, work, having space to ourselves. And often these management strategies would help us cope with the parts of ourselves or another that we don't like facing. And so what I think many of us are probably experiencing in our relationships can be a lot of stress. And I think old wounds flare, old patterns become frequent or intense. Our shadow selves make more of an appearance. My husband and I have two funny names for each other when our shadow selves sort of make that appearance. And often it's due to tiredness, it's due to overload. And I think recognizing that in each other and ourselves helps us to breathe through it. So yeah, so love tanks and appreciation tanks run low. There's often no time or privacy to talk if kids are also in the picture. And look, I can really attest to these feelings throughout lockdown. It is challenging, and not having the time and space to work through conflict often brews more conflict. And yeah, it is really, really difficult. So again, finding that self-compassion for yourself and others. We're all human and we're all vulnerable. This, however, does not excuse emotional and physical abuse, and women experiencing that need to seek help. Self-compassion is saying, I'm not perfect. I'm more than this one negative moment or mistake. You learn then to let the pain go rather than fixate on it. So finding support. And that sort of emotional support. And NIIM, I know, has some excellent practitioners that you can look into for this. It can be an opportunity to work through your trauma and grow, or it might just be finding someone to hold an emotional space for yourself. We all need, and this is really important human need, to be heard very deeply, deeply. Partners often, I think, in the situation of COVID and with the pressures they're going through as well, can't always do that effectively. And that's where it's really helpful to find a counselor, a psychologist, a psychotherapist, a somatic experiencing consultant, a core energetics practitioner that can help hold a space for you to release those emotions and talk about your fears. And I would say during this time, if financially can, it's you can get a mental health care plan from your GP, is having that sort of regular session with someone to touch base and to talk through those feelings. Some really other amazing tools that I've used personally and I give to my patients is the emotional freedom technique. And the emotional freedom technique is about tapping different points on your body. And there are different visualizations and different meditations you can do while doing that tapping sequence. And on my PowerPoint, which you'll get, there is 2 resources. One is an app, the Tapping Solution app, which is a great app which you download on your phone. And it has a little avatar on it, which shows you where to tap. And it takes you through different emotions, different things that you're going through. And I, from my personal experience with it, as well as my patients, it's phenomenal at reducing stress and reducing that somatic feeling of uncomfortable feelings. And it helps to release it out of the body. The other resource is Happy Soul. It's actually a practitioner's website, and she's got a lovely lot of videos, and a lot of them are sort of COVID relevant as well, to help you diffuse those sort of somatic feelings, uncomfortable somatic feelings that you're feeling. So finding support where you can, if you can get that regular body worker or an acupuncturist, someone who can do massage to release that as well, is really good. You can seek out a practitioner, if it leads to sort of health deterioration. So you can get those referrals from your doctors. Routine really helps with coping with uncertainty. Develop a routine which is simple and achievable for your day. So with those essential things that we forget, get it out of the way in the morning to set the tone for your day. And there's a really nice little nursery rhyme that I came across by Wayne Fields. The best 6 doctors anywhere, and no one can deny it, are sunshine, water, rest, and air, exercise, and diet. These 6 will gladly you attend if only you are willing. Your mind they'll ease, your will they'll mend, and charge you not a shilling. So it's a really nice reminder that some of the, there are some really simple things in life. If you can get them into your routine, can help your mind and your body during this time. Walking, research shows that walking amongst trees really helps to reduce stress. So find yourself those beautiful walks around you. And we're very lucky in Melbourne, we have access to that. Get your green hit, even if it means dragging yourself out the door. We're lucky, we're allowed to walk with a friend. So, you can kind of schedule those walks with your friend or friends through the week. And that means you get someone to talk to and download to as well. Grounding, my daughter loves to do this, and she does this very naturally, lying on the grass or ground to settle her nervous system. It's really, really powerful for feeling connected and feeling safe. Sunshine, sit out in the sunshine. And if you, unlike me, you don't have a 6-year-old at home who doesn't really allow me any bit of peace, have a cup of tea, be still, even for 10 minutes, practice mindfulness, feel the breeze, watch the birds, watch the leaves, watch the clouds, practice a short meditation. And so I thought I'd take you through a really quick Be Here Now meditation, which I do in my daily practice and also when I'm feeling unsettled about something. So I thought I'd take you guys through it and see if it helps, give you a tool if you don't already know this meditation. So just finding yourself a comfortable seat and shut your eyes. And take a breath in for 3 counts. So breathing in nice and slow, 1, 2, 3, and then 3 counts out, 1, 2, 3. With each breath, try and lengthen your breaths to more counts. I want you to try and feel the ground under you, supporting you, whether that's through your feet or your back. Shut your eyes and listen really carefully. Name in your mind 3 things you can hear close to you. So just tuning into that silence. Now name 3 things you can hear far away. Listen really carefully. And then name things that you might be able to smell, taste, or feel. It doesn't take long to practice this, but it really does settle you down. And it's something that you can do throughout the day to just feel that sort of safety and feel that connection to yourself. And yeah, the connection to just being in the moment. So I thought I'd give you some quotes to inspire you about that and why it's important to be here now with your breath. And there's one by one of my favorite Buddhist teachers, and it's his name's Thich Nhat Hanh, and I'm sure many people would know of him. So it's breathing in, I calm my body and mind. Breathing out, I smile. Dwelling in the present moment, I know this is the only moment. The second quote is by John Kabat-Zinn, and it says, little moments, they aren't that little. And I think COVID is an opportunity to really tune into this part of existence, in really cherishing those really small moments, whether it's a rainbow or the sunshine, or a beautiful day. Water. I find it's really useful to brew some nice herbal teas in a jug and keep drinking it through the day. Herbal teas and drinks can be used to support the nervous system. So there's some nice adaptogenic herbs like ginseng, there's reishi, cordyceps. There's more calming herbs like passion flower, chamomile, lavender, verbena, and hibiscus. Talking about stress reduction as well, sometimes taking, a herbal tonic of adaptogens, which you can pick up from dispensary, can also be really, really helpful as well, especially if you're experiencing a lot of stress and anxiety and difficulty sleeping. Food, I think we've got to be real. It's hard in lockdown to be strict and follow, very, very rigid, anything, I think, in a very rigid way. And so as much as I'd like my patients to be following a protocol, over the year, I've really told them to follow, Buddha's middle way concept, and that's finding that 80-20 balance. It's trying and eating clean, whole foods, trying to incorporate some fasting, and that can be either your 18-6, which is 8 hours of eating and 16 hours of fasting. So you choose your 8 hours. I find it's useful to do, have break my fast around 10, maybe have some fruit, then have a meal, and then you finish off your last meal by 6. Some people do more the 5-2 fast, which is 500 calories or 500 to 800 calories twice a week. So try your best to do what you can, but I think, go ahead and enjoy that, Provido Uber Delight when you need with some candlelight. I mean, we can't go out right now. And I think, you have to exert some degree of flexibility and enjoyment with these things. Night routine, we are also coming to late night TV. I mean, those of you with kids, it's the only time you get. By the time I finish work and I put my daughter to bed, it's 8 o'clock, and it's just that last hour and a half before bed. And, it's nice to just switch off and watch something. See if you can, some of the days, find other ways to switch off. Sometimes the screen is more of a sensory load. And I often find that when I don't do the screen at night and I actually make a conscious decision going, look, this is just a habitual thing, I'm probably not going to feel any better from watching this show, and instead listen to some music in a bath or a foot bath, I do feel so much better for it. So it's just making those conscious decisions. Nighttime routine options could be knitting, listening to music, meditation, developing your artistic talent, yin yoga, have a chat with a friend, listen to a podcast, and as I mentioned, have a bath or a foot bath. COVID is an opportunity to discover some hidden talents. I'm looking forward to a couple of weeks off, and I'm looking forward to signing up for some Artify courses, which have some, beautiful online options in terms of learning, going deeper into oils and abstract art. So I'm looking forward to that. There's carpentry, there's knitting, there's pottery, doing a garden, mastering a green thumb, bookbinding. So there are many things that you can kind of do a deep dive in. And I guess there is that opportunity to do that. So I thought I'd also tell you about my daily routine, more my inner strength one. And my morning meditation involves the 2 minutes be here now meditation, which I took you through. And my other meditation is an adapted one from Joe Dispenza, which many of you, again, I'm sure would have read his books. And I thought I'd take you through it as well, because I think it's useful because it really does. It's simple, it's easy, it's quick. You can even do it in a couple of minutes as you get more practice at it. And it really does shift your emotional space. So sitting back again and taking a breath in. So breathing in for 3 and then breathing out for 3 counts. And then I want you to imagine a point at the base of your spine and visualize a positive emotional memory. So that's any memory which has an emotion of happiness or joy, and let that point radiate with that emotion and radiate outwards. So sitting with that for a while. Imagine a point at your sacrum and visualize a positive emotional memory. So moving up your spine and let that point radiate outwards with that emotion. Kind of like a light beam. Moving upwards, imagine a point in your stomach and visualize a positive emotional memory or feeling and let that point radiate with that emotion. It can be an emotional memory, a past one, or it could be something also into the future, a visualization of something into the future. Imagine a point in your heart and visualize a positive emotional memory and let that point radiate. Moving upwards to your neck, imagine a positive emotional memory and let that pain radiate. Moving up to your forehead, do the same. Moving up to the top of your head and visualize a beautiful memory and let that point radiate with that emotion. Imagine those positive emotions radiating out of your body and holding you. And then imagine that energy going out and touching all the people around you that you love. And then imagine it encompassing the whole world. Sit in that glow for a few minutes and enjoy it. So this is a bit of an adaptation of the Joe Dispenza meditation as well as Heart Math. And Heart Math is also a very beautiful course that is, there's a freely available course online which you can do. Again, very deeply grounding and heart-opening meditations. So my daily routine at nighttime, and I have fallen off the wagon a little bit as clinic has got really busy in the last couple of weeks, but is nighttime yin yoga. And I have an amazing book, which I've discovered over lockdown, and it's called Insight Yoga. And the lady that the author of the book is Sarah Powers, and Sarah Powers has dedicated, I guess, her life to this restorative or yin yoga. So what is yin? Yin yoga has its roots in China, and unlike the more popular and active yoga disciplines that I think many of us are quite familiar with, which, they originated in India, it was founded on the Taoist theory of yin and yang. And these are the opposite concepts that together represent our balance. Yin is stable and passive, while yang is active. So this is very much a passive, stabilizing practice. The yin poses, therefore, are passive and performed while seated or reclining or lying down. The poses are held with the muscles fully relaxed, allowing time and gravity to deepen the stretch and target the fascia. The time spent holding the poses is often longer to normal active yoga. So why yin? It's restorative, it's calming, it helps the body to release emotional tension. It helps us to learn to breathe through the discomfort of stillness and the discomfort of difficult emotions. It allows us to be with ourselves, and this daily practice helps us to build resilience in our day. So why focus on breath? And I think this is another quote by Thich Nhat Hanh, and it's feelings come and go like clouds in a windy sky. Conscious breathing is my anchor. And really, yin yoga is a really good way of practicing that without just having to do a sitting meditation. You at least you move through those poses. And I found it through COVID has been really good. And it's something I can literally before bed, just put the mat out, do it, sit there for 15 minutes, hold each pose for 3 minutes. I often put a candle on, I put some nice music on, I put my earphones on so I can tune out everyone else in the house. I support my body with bolsters and blocks to allow this to be a really passive pose, and there really should be no pain. I often find I feel I'm more invigorated by yin yoga practice than an active yoga practice. So a final quote, the present moment is the only time over which we have dominion. And really, I think this era that we're in and this time is a way of, going into that deep truth and finding joy in those small moments. Thank you.
Wow, I've got a problem here. I can't put my video on, but that's okay. Wow, thank you so much. So thought-provoking. And, I do my weekly sessions with my psychoanalyst, and now I have Wayne Fields, the 6 best doctors. Thank you, Anjana. Brilliant. Absolutely sensational. Now let's open up for questions. I know we're running a little bit behind time, but you have submitted questions online prior to today, and we'd love to explore those questions with our 3 speakers. But also, if you do have any other questions, try and use the chat box, but I can't guarantee you because time has escaped us. So our first question is to Carolyn. Carolyn, healthy aging. Do you have any tips, suggestions for older women?
So I suppose to define healthy aging is being as independent, mobile, disease-free and happy for as long as possible. I suppose it goes back to my talk. And in fact, the World Health Organization found that of all factors that impact health, exercise was the most impactful on healthy aging. It had the most positive effect over any other, even over smoking, alcohol, demographic. So I suppose the first thing is keep moving. And so moving maintains bone density, maintains muscle mass. Muscle mass is important because it reduces because as your estrogen goes down as you get older, your muscle mass starts to reduce, which then increases your risk for diabetes. And the other thing that exercise does is it maintains perfusion to your skin, so you actually look better. And then in terms of diet, I keep things simple. So good quality, lean, good quality, clean diet. True to your heritage or Mediterranean diet. Otherwise, our ability to process toxins reduces as we get older. So as clean as possible, enough carbohydrate, enough fat, enough protein. So don't restrict any of those. They just need to be good quality. So I'm not a proponent of low carbohydrate diet. In fact, I think it puts more stress on the body, particularly female bodies. And the other thing is maintaining good supports and connections. So the one thing that an assessment found was that that mental health issues were often related to women being having to take up a carer role as they got older. And so, so maintaining good supports and connections is important.
Thanks, Carolyn. That's fantastic. My next question is to Gorata. Hormonal imbalances, Gorata. How to fix it, and what is the role of stress on all of this?
Right. So during when people are stressed, that actually increases one of the hormones in the body called cortisol, and that is actually from the adrenal gland. So cortisol and progesterone both come from pregnenolone. And therefore during stress, because cortisol goes, so the body favors cortisol more, therefore there's more cortisol production with less progesterone, with low progesterone. And then with low progesterone, if you remember that as an anti-anxiolytic, so low progesterone actually sort of it would actually cause anxiety, sort of cause headaches, weight gain, so like those mood disturbances where people actually crave more food or sort of unhealthy food. That's because of the low progesterone. And with the low progesterone, because of the high cortisol produced by stress, is that it actually sort of results in indirectly sort of increasing estrogen, which is not good, because estrogen, which is unopposed, actually leads to an increased risk of breast cancer and endometrial cancer. So really chronic stress levels are not good. So because chronic stress means more cortisol, and then chronic, if it's still chronic, it means that the adrenals get fatigued, resulting in low cortisol, and that actually sort of causes the body to be immune suppressed. So yeah.
Thank you, Gorata. SIBO, that's an interesting phrase. What is the cause and how do I fix it, Anjana?
Okay, so SIBO stands for small intestinal bowel overgrowth. We believe the pathogenesis of SIBO is usually food poisoning. There can be other things, obviously chronic bad diet, resulting in like chronic constipation. But basically the theory behind SIBO is that you've had food poisoning and our body gets a bit confused, and it starts to attack a part of our intestine, which deals with motility. And it's like a form of autoimmune response. And so those motility fibers sort of affected. And so we result in dysfunctional motility. And so the small bowel is, I guess, it's a small intestine, so it's the upper gut. And so ideally in that area of the bowel, we're not meant to be fermenting in that part of the bowel, but when bacteria go there, this results in fermentation, and that results in symptoms of fatigue, bloating, constipation, diarrhea, mood swings, hormonal dysfunction. So it's a really important thing to fix digestively, and it is a very core part of my work in what I do in terms of rebalancing people's digestive tracts, as well as a core part of treating chronic fatigue, which is my area of special interest. Yeah, that pretty much sums it up.
Terrific. Thank you so much for that. Pre-diabetes. Carolyn, what signs do I look out for if I have just diabetes?
So I think that was a really good question, because it highlights the fact that pre-diabetes is often asymptomatic. So there's usually no symptoms whatsoever. And so for gestation, once you've had gestational diabetes and then you are at risk then of developing type 2 diabetes following, the recommendation is that you get a yearly screening test, a glucose tolerance test. and because you won't know necessarily that you've got it. It's quite you'll only realize that you've got diabetes in terms of, you know, excessive urination, tiredness, other symptoms, once you've actually pretty much developed diabetes. And there's this long preamble before that, which can be, you know, years, where you can catch it early. So so my answer is no symptoms, you have to screen for it, and it's a yearly test.
Perfect. Gorata, what nutrients are most important for healthy hormones?
So in terms of healthy hormone promotion or production, is that what I would actually advise is, as Caroline has already mentioned, so exercise, making sure that we actually get adequate exercise, adequate sleep, so eating well as well, avoiding sugar, a lot of sugar, but everything in moderation. So an anti-inflammatory diet as well, and sort of just supplementing our diet as well with sort of vitamins such as vitamin D, chromium, alpha-lipoic acid, just to promote sort of healthy hormone production. It's mainly lifestyle factors, unless if somebody has got a particular hormonal issue that I guess we need to sort of tailor management around that.
Terrific. Anjana, this is a question on mold. How can I get tested, and what can I actually do about it?
Yeah, so first step with mold is to get your house tested. And that is getting a building biologist in to do some air sampling and some testing the walls for moisture, getting up in the roof, getting into the subfloor, so that you can diagnose, I guess, the house and what's going on and what you need to fix. And then that requires obviously remediation. So a good place for resources and all that is Nicole Bilsma's website. It has a list of suppliers, it has a list of remediators, it has a list of building biologists that are trained by her. I only go with her trained professionals because they know what they're doing, and they understand, I guess, the patients and what the patients that I treat and what they're going through. The second step is coming in to see a practitioner that obviously knows about mold and who can take a thorough history. And there is a biotoxin cluster symptom list that is quite useful. And if you score 8 or more, then that's highly suspicious for biotoxin illness. So mold basically produces biotoxins, and those toxins result in inflammation in our body, brain inflammation and body inflammation, and that affects all the different organs, can infect all the different organs in our body. And so it's a big, I'd say it's almost 70% of the chronic fatigue patients that I treat and fibromyalgia treatment patients that I treat are mold related. The other big thing with it is also it does, and a lot of patients would attest to this, it brings up anxiety, depression, panic attacks, and can bring up trauma as well. And a lot of people have resurfacing PTSD. And that, I think, is due to potentially the neuroinflammation going on, and reduced, stress levels, as well as potentially not being able to metabolize adrenaline well. So it is going in to see a practitioner. Unfortunately, in Australia, we don't have the testing that they can do in America. We don't have access to those labs with a reputable lab. The test that we can do is we can do nasal swab testing, Marcon's testing. We can do some of the hormone markers, but really mold for me as a clinician treating this is a clinical diagnosis. It is based on the history. It's based on symptoms and examination. Ideally, one day when we get the testing in, yay, we can do the testing, we can actually see people and track them. But often what I'll see is the biotoxin symptoms start to go down and start to disappear as people are getting better. And that's kind of my way of tracking people at this stage. But hopefully one day we'll get a lab that can do the American testing with the correct assays.
Thank you. Gorata, I've got an interesting one here. Are there any updates on when or if appropriate to use identical hormones?
All right, so very, because I was having a look at that and researching that, and I had a look on RACGP, very controversial. So what I would suggest for anyone wanting to use bioidentical hormones is that come and see somebody like integrative health practitioner, have a thorough history taken, so and have all, like, we need to screen for all the risk factors, because yes, bioidentical hormones are actually similar to our hormones, the hormones that actually the body produces, but we still need to actually assess the risk of breast CA, endometrial CA, before we actually give them to a patient or a client. So we need to actually assess first, and then a person has a choice in terms of picking the treatment. So that's what I would say.
I knew it was complicated. Carolyn, we'll finish off with you, Carolyn. And I think it's, I mean, your presentation was great in respect of, weight gain and how to kind of explore exercise as a key factor in battling lockdown, as well as maintaining your fitness. But how do you actually help reduce weight gain after menopause?
Okay, so as we know, the hormone changes with menopause are predisposed to weight gain. So the reducing estrogen so it leads to this insulin resistance as well. And then abdominal fat deposition with that, which then worsens the whole insulin resistance. Reducing estrogen leads to reduced metabolism and reduced muscle mass, which again reduces metabolism, and so it's a bit of a vicious cycle. So the approach is obviously try and maintain your muscle mass, because that is the metabolic tissue of your body, which chews up your food. So maintain your muscle mass by weight training and exercise. I don't recommend low carb diets. I recommend healthy carb diets, so good carbs, so whole grain carbohydrates, enough protein and enough fat. So don't restrict any of the macronutrients, because then your body tends to go into a stress response, which then worsens weight gain. So keep true to your heritage in terms of the foods that you eat, and Mediterranean diet if that's appropriate. So a lot of fruit and veg, a lot of fresh foods. That should be most of what you eat. Like Horata mentioned, a low inflammatory diet. For women, incorporating those foods that Horata spoke about, that have got the isoflavones, so the estrogenic type, which again can assist with that counteract those issues that our body has with reducing estrogen. So unrefined good oils only. And then, in terms of the exercise, so weights as well as a bit of intensity there. So that intensity is worth so much more than going for 2 hours walk. Having a little bit of fast and slow over 20 minutes is a lot more effective. Yeah.
Thank you, Carolyn. In fact, thank you to everyone for providing early thought in respect to the questions. So on behalf of NIIM, I really want to thank the three of you. Sensational. This could go on all day. I really believe that. You've invested your personal time and you've created such informative presentations and really, really insightful. So thank you from the bottom of my heart, because I've learned a lot. May I please remind attendees that NIIM is a not-for-profit. We get no government funding for our life-changing work. So if you are able to support, we would love you to. Your contributions will be greatly appreciated, and they're tax deductible. And they can also be made via the NIIM website, of course, www.niim.com.au. On behalf of NIIM, our very best wishes to one and all during Women's Health Week 2021. Thanks for your presence. Take care, look after each other, be kind, and take the time to prioritize your physical, emotional, and social health. Please follow us on social media, Instagram, Facebook, or LinkedIn. Until the next time, Please stay safe. Thank you.
Thank you, everyone.
Bye. Thanks.